Good afternoon, everyone. We're going to call this meeting of Health and Human Services to order. Today, colleagues, at this time, we have one readout. That's going to be from the Department of Human Services, Social Services, and we'll ask Ms. Bugel, our analyst, if she could start.
Thank you, Mr. Chair. The fiscal 2026 budget for DHS Social Services Administration increases by $11.8 million, or 1.5%, to a total of $791.2 million. Moving on to performance analysis on pages 5 through 7. DHS usually reports measures on child safety, child placement, and adult safety measures that is included in the performance analysis section of the analysis. However, DHS did not include actual data for fiscal 2024 and reported that it was unable to provide this data due to concerns about reliability. DHS should comment on the efforts that it will take to improve the reporting of these measures. DLS recommends adding budget bill language restricting funds pending submission of MFR data. Moving on to deficiency appropriation on page 8, the fiscal 2026 budget bill includes deficiency appropriation totaling $47.3 million. $18.5 million is in general funds, $0.4 million in special funds, and $28.5 million in federal funds. The deficiencies include $38.3 million for foster care fiscal 25 shortfalls, $8.1 million for foster care fiscal 24 shortfalls, $1.4 million for contractual services for the foster care rate reform, a reduction of $500,000 to reflect projected overtime payment within child welfare services. Exhibit 3 on page 9, we have the overview of agency spending. Foster care maintenance payment accounts for $395.6 million, or 50% of the total budget for SSA. The second largest chunk is for personnel expenses, which is about $297.6 million, or 38%. Within personnel, the largest area is in child welfare services, which is about $238.8 million. Moving on to Exhibit 4 on page 10, we have the proposed budget change chart. Fiscal 26 allowance increases by $11.8 million compared to fiscal 25 working appropriation. The increase is primarily due to increase of $14.2 million in regular personnel expenses. Excluding costs associated with proposed deficiency appropriation related to fiscal 24 shortfalls, the fiscal 26 allowance for foster care maintenance payments increases by $7.2 million, or 1.9% compared to fiscal 25 working appropriation. On page 11, we have a discussion on the implementation of new foster care provider rate structure. DHS began implementation of a new rate system in fiscal 2025, which applies to institutional providers who are the highest cost provider type. The revised rate structure includes 2 sets of rate programs for direct and clinical care. On Exhibit 5 on page 13 shows the fiscal 25 residential child care provider class rates compared to fiscal 24. Depending on the service class, the increase in daily class rates ranges between $66 to $679. However, for class 5, the rate decreased by $446, or 18.3%. Exhibit 6 on page 14, we have the average monthly payments for purchased institution. The average monthly payments increased by $19.5 million in fiscal 25 prior to the implementation of rate reform. Following the rate reform, average monthly payments further increased by 19.2%. Purchased institution increased by $2.4 million in November and further increased by about $0.5 million in December of fiscal 2025. Exhibit 7 on page 15, we have the total purchased institution expenditures. DLS estimates that the total annual cost for purchased institution in fiscal 26 will be $170 million, reflecting an increase of $50 million from fiscal 24. DLS estimate for fiscal 25 based on the 2-month data available since the implementation of rate reform is about 22.5 million higher than the DHS estimate. On page 16, we have a discussion on the status of Medicaid state plan amendment. DHS indicated that Maryland Department of Health was expected to submit the state plan amendment with an effective date of July 1st, 2025. This will allow reimbursement for the clinical rates for certain residential classes. However, fiscal 26 allowance does not include funds through Medicaid for foster care. DLS is asking DHS to comment on when the Medicaid claims are anticipated to begin for residential interventions for children in out-of-home placements, and why the anticipation of these funds were not accounted in fiscal 26 allowance. DLS recommends adopting committee narrative requesting an update on the second phase of the rate reform, which will implement a new foster care provider rate system for purchased homes, and an update on the number of youth served by the new foster care provider rate structure by class type and cost of class type in fiscal 25. Exhibit 8 on page 17, we have the foster care caseloads. In fiscal 2024, the overall caseload declined by 6%. Fiscal 25 data through December 24 shows the number of youths in out-of-home placements paid by DHS have increased slightly by 0.3%. Regular foster care caseloads have increased by 7.9% through the first half of the fiscal year compared to fiscal 2024. Exhibit 9 on page 18, we have the subsidized adoption and guardianship chart. The average monthly number of subsidized adoptions decreased by 1.2% in fiscal 24, and subsidized guardianships increased by 2% in fiscal 24. Exhibit 10 on page 19, we have the caseload projections by placement types. DLS estimates for the full year of fiscal 25 caseloads and 26. DLS estimates the overall placements will decline slightly in fiscal 25 and increase slightly in fiscal 26. Exhibit 11 on page 20, we have the data on placement cost for 3 most expensive provider foster care placements. Average monthly placement cost for purchased institution increased by 3.2% in fiscal 24 and further increased by 27.4% during the first half of fiscal 25. Exhibit 12 on page 21, we have the foster care maintenance payment program expenditure forecast. DLS forecasts a shortfall of 5.2 million in fiscal 25, of which the general fund share is 21.2 million. In fiscal 26, DLS projects a deficit of about 7.4 million, of which the general fund share is 10.4 million. The forecasted shortfall in fiscal 25 and 26 is mostly driven by increase in purchased institution cost, as well as the different assumption of Title 4E availability in fiscal 25. DLS finds that the nearly 20% increase in rates for institutional providers in fiscal 25 is not affordable given the state's budget outlook. DLS recommends 5% reduction in rates for fiscal 26, which will save the state 8.5 million, 7.6 of which is in general funds. DLS also recommends a provision to be added in the Budget Reconciliation and Financing Act of 2025 to prohibit Interagency Rate Committee from providing rate increases for fiscal 26. On page 22, we have the personnel data. The vacancy rate as of December is about 8.4%. Total vacant positions in SSA have decreased by 120 since December 2023. The largest number of vacant positions is within the child welfare services, which is about 174. Moving on to the first issue on page 23, we have a discussion on the out-of-home placements of children and youth. Exhibit 13 on page 23 shows the number of children in out-of-home placements across all agencies declined by 19.8% between fiscal 2020 and 2024. Exhibit 15 on page 25 shows the out-of-state placements. The total number of children and youth in an out-of-state placement increased by 5% in fiscal 24, following a 46.1% decline between fiscal 2020 and 2023. In addition to the data provided by the Governor's Office of Crime Prevention and Policy, DHS usually publishes monthly out-of-data on its website for children and youth in out-of-home care. The most recently posted data available is through December 2023. As of January 25, this data has not been updated. DLS recommends adopting committee narrative requesting reports containing monthly out-of-home placements data. In Exhibit 17 and 18 on pages 27 and 28, we have the outcomes for the effectiveness of in-home family preservation services provided by DHS. The percentage of children served through in-home family preservation services during fiscal 24 and experienced an indicated finding of child maltreatment from Child Protective Services investigation is shown in Exhibit 17. Moving on to second issue that starts on page 28, we have a discussion on the evidence-based prevention practices implemented under the Family First Prevention Services Act. Committee narrative in recent years has requested DHS to provide report on this issue. DHS reports that 19 jurisdictions have implemented at least one of the 4 practices, and a total of 530 families were served in 2024. DHS submitted a revised public assistant cost allocation plan in December 2020 to allow DHS as necessary to claim reimbursement for prevention services retroactively from October 2019. DHS should comment on the status of the approval of the revised cost allocation plan and the cause of the delay in the approval. On page 30, we have a discussion on the evaluation of outcomes for participating families. DHS reports positive outcomes for the evidence-based practices. On page 31, we have discussion on the qualified residential treatment programs. The FFPCA also included provisions amending the eligibility for federal reimbursement for certain non-family placements. To be eligible for this reimbursement, non-family placements in childcare institutions are limited to 2 weeks unless the program is designated as a QRTP. The number of QRTP designated providers remained at 6 as of December 2024. DHS should comment on the planned future efforts to solicit applications for additional QRTP providers. DHS had previously also reported that they were working on establishing appropriate processes to claim for federal Title IV-E reimbursement for funding of non-family-based placements. DHS should comment on the status of the processes. Issue 3, starting on page 32, we have the child welfare caseload and staffing report. In recent years, DHS has been requested to provide report on caseload to staffing ratio. As shown in Exhibit 19 on page 34, SSA had 316 more caseworker position and about 20 more supervisor position than necessary to meet the Child Welfare League of America standards based on September 1st, 2024. DHS has reported to be in the process of developing a child welfare workload assessment procurement. DHS should comment on the estimated completion timeline of the child welfare workload assessment. DLS has determined that the information provided in the report by DHS complies with the language restricting the general fund, and DLS therefore recommends the release of $250,000 in withheld general funds and will process a letter to this effect if no objections are raised during the budget hearings. DLS also recommends adding language restricting funds in fiscal 26, pending submission of the report with data as of September 1st, 2025. Issue 4 on page 36, we have the hospital overstays for children and youth in out-of-home care. In recent years, DHS has been requested to submit data on youth in out-of-home placements served in hospitals. The report was due on December 1st, 2024, but was not submitted until February 6, 2024, so it was not included in this analysis. DLS recommends adding language in the fiscal 25 holding funds until a report containing this data is submitted. Issue 5, starting on page 36, we have child fatalities involving child abuse and neglect. As of December 11, 2024, there were 20 child fatalities that involved child abuse and/or neglect in calendar 2024. DHS was unable to provide jurisdiction-level data as it has provided in the past. DLS recommends adopting committee narrative requesting DHS provide child fatalities data by jurisdiction. Starting in page 38, we have the operating budget recommended actions. The first recommended action restricts fund until a report with data related to the CWLA caseload standards is submitted. The second recommended actions restricts fund until a report with data related to the hospital stays is submitted. Recommended actions third restricts fund until a report with data related to hotel stays is submitted. Recommended action 4 restricts fund until the managing for results data is submitted for fiscal 24 and fiscal 25. Recommended action 5 recommends adopting a committee narrative requesting update on implementation of provisions of the Family First Prevention Services Act, which is similar to previous years. Recommended action 6 requests data on child fatalities where abuse or neglect are determined to be contributing factor. Recommended action 7 is an annual language that restricts general fund appropriated for foster care maintenance payment to be used for foster care only. Recommended action 8 reduces general and federal fund within the foster care maintenance payment program. This reduction is associated with the 5% rate reduction for institutional providers. Recommended action 9 requests data on monthly out-of-home placement of children and youth. Recommended action 10 recommends adopting a committee narrative requesting foster care provider rate reform data. Recommended action 11 requests data on the costs associated with placing youths in out-of-home placements in hotels. Recommended action 12 and 13 are annual languages. And with that, I conclude my presentation, and I'll take any questions you may have.
Seeing no questions, it's appropriate to bring up the respective agency. Madam Principal Deputy Secretary.
Good afternoon, Chair McCray and members of the committee. I'm Carnitra White, and I serve as the Principal Deputy Secretary for the Department of Human Services. Happy Friday, happy Valentine's Day. We'd like to thank Governor Moore and Lieutenant Governor Miller and the Department of Budget and Management committees for their support. We're also grateful to the Department of Legislative Services, our analyst, Ms. Vujel, for her budget analysis. Joining me at the table today is Dr. Alger Studstill Jr., who is our Executive Director for the Social Services Administration, as well as Jessica Smith, who is our Acting Chief Financial Officer. We also have members of our leadership team present in the audience, including our Deputy Secretary for Operations, Gloria Brown Burnett, as well as our Director of Worcester County Department of Social Services, Mr. Roberta Baldwin. While you have our written testimony, we would like to highlight a few items, and then we'll address the issues raised in the analysis. As I mentioned in our overview hearing, in December of 2024, we launched a bold new approach to strengthening family connections. We like to call this Family Matters. Family Matters reflects our belief that every child deserves a safe, loving, and stable home with people they know and trust. I like to say that every child deserves to grow up in a family, and I hope that you all will agree with me that children deserve to grow up in families. Family Matters shift our culture and practices across the agency to strengthen and support family relationships. The enactment of the 2024 kinship law allows us to do a couple of things. One, offer new resources and training to empower kin caregivers to meet the needs of young people they love. And it prioritizes kin care and facilitates lifelong connections for youth who are in our foster care system. When we began this work, only 24% of our youth were placed with kin. As of Monday, February the 10th, 27% of our youth were placed with kin. It's a small improvement, but it's an improvement nevertheless, and we will continue to make improvements to ensure that children are able to grow up in families and that they are able to have strong family relationships. Now I'd like to talk a little bit more about our work to reduce hospital overstays. I know you often hear that we are not proactive in our work to reduce the number of youth who are in hospital overstays or hotels. However, we have taken steps to limit the number of youth who are experiencing a hospital overstay by addressing systemic gaps and increasing communication and collaboration. This work requires us to be innovative in our approach and work with our partners to meet the health needs of our youth. Many of you know I'm a former local director of social services. I served here in Anne Arundel County as the director of social services for 8 years. And I can attest to the efforts that go into identifying an appropriate placement for youth who is in an overstay status. Let me highlight an example for you. A youth came into our care who was hospitalized for aggression, inappropriate behaviors, and cancerous tumors. There were challenges finding a post-discharge placement due to these complex issues. Unfortunately, multiple providers denied placement for this youth. Our local department team worked collaboratively with our SSA team to identify alternatives. SSA and the local Department of Social Services partnered with the local school system for IEP updates, as well as educational services while the youth was in the hospital. We collaborated with our state agency partners, the Behavioral Health Administration, as well as the Developmental Disabilities Administration, holding interagency staffings regarding this young person and how we could meet their complex health needs. Through these efforts, a new enhanced behavioral respite program was created. The youth was accepted into the program. Not only was this youth accepted into the program, but this resulted in 6 additional beds being developed that were available for youth in our state who have complex needs. I hope you see that when we are facing these complex situations, we don't give up. We work tirelessly, and that is our collective local Department of Social Services staff, as well as our Social Service Administration staff, to find an appropriate placement that meets the needs of the young people that we serve. We are building on and continuing this vital work in 2025. As you read in our written testimony, on February the 6th, 16 DH youth were in hospital overstay status. And we had 28 youth who were in hotels. However, as of yesterday, 12 youth were in hospital overstay. That's probably the lowest number that we've had since we've been in office. Granted, 12 too many, but I hope you see that the efforts that we're taking are producing results. In fact, last year, this time, 21 youth were experiencing hospital overstays, and 54 youth were experiencing hotel stays. And of the 12 youth that are currently experiencing a hospital overstay, We've identified appropriate placements for 6 of those youth. The remaining 6 have unique needs that are not easily met with the systemic reforms that we have put in place. A key factor in assisting with addressing the systemic issues has been rate reform. Thanks to the support of the budget committees and the governor's office, rate reform went into effect October 1st, 2024. This $27 million investment created a new category-based rate structure to incentivize our residential child care providers to develop innovative programming when a youth needs are not being met by our current continuum of care. Our new way of compensating out-of-home care providers is already increasing the range of services we can provide. And you can see that by the example that I just provided. This wider range of services reduces out-of-home placements, hospital overstays, and hotel stays, and ultimately will save us money. Prior to our administration, key data elements, including hospital overstays and hotel stays, were either not tracked or were tracked manually. Unfortunately, we continue to discover challenges with the data reporting processes we inherited. Using our existing budgetary allocations, you've heard me talk about the fact that we created a data office to modernize the agency's data collection and public reporting across our administrations. One priority of the data office is to publish an interactive dashboard showcasing key statistics. And I'd like to give you an example or preview of what that dashboard will look like. And so Mr. Yee is going to assist me with pulling up. So you'll see here from this slide, this is a sample of the dashboard page. And the data will include points about placements. It will also have placement plans, so the different placement plans for our youth, as well as other child welfare indicators. And not only will we have this information, if you go to the next slide, it will be broken down by jurisdiction. So you could hover over the different jurisdictions and get jurisdictional data for our youth who are also in out-of-home placement. Thank you, Mr. Yee. The data will be published in a manner that promotes transparency while protecting privacy and confidentiality. The dashboard will increase transparency with the reduced manual reporting will also improve efficiency. With that, I will turn to our responses to the DLS analysis. Regarding issue 1, our efforts to improve reporting on child safety, child placement, and adult safety measures, as I just mentioned, we are focused on data integrity and building out dashboards. Our priority is to ensure that any public-facing data is consistent, validated, and comprehensive. We will work with DBM to revise our managing for results indicators based on our modernized approach and ensure that our measures align with our priorities. We will include the new measures for these areas in our new MFR submissions. The next issue regarding Medicaid claiming for residential interventions for children in out-of-home placements, we concur with the report requested. We continue in partnership with the Maryland Department of Health and the Department of Budget Management on this component of rate reform. Next is the recommendation for a 5% reduction in rates in the FY26 new rate setting methodology. We do not concur with this recommendation. As I mentioned in my testimony, rate reform is a key factor in assisting us to address systemic issues in our continuum of care. And it gives us the ability to prevent hospital overstays and hotel stays. It allows us to work with our provider community to create programming to meet the unique needs of our youth. The next issue with regards to reports containing monthly out-of-home placement data, as I mentioned, this data will be on our public-facing dashboards. We don't want to create duplicative work. Therefore, we do not concur with this recommendation. And now I'll turn it over to Dr. Studstill, who will address the next 6 issues.
Good afternoon. In regards to the DLS request on an update for our 5-year Title IV-E prevention plan, We have extended our 2020 to 2024 plan while we refine our eligibility criteria for prevention services, as well as our expansion plans based on the FY 2026 budget. We plan to submit our amended prevention plan by June 1st of this year. The next item in regards to an update on the revised cost allocation plan and the delays in approval. The cost allocation plan amendment, which became effective on January 1 of 2020, was approved on September 30th of 2024. The next DLS item was additional QRT providers and Title IV-E reimbursement on federal claiming. We have revised how providers obtain a QRTP designation as part of our rate reform work in 2024. In FY 2025, 2 additional providers have received the designation for a total of 8 QRTPs in the state of Maryland. We continue to work with providers to help them meet the QRTP requirements, and we anticipate that additional providers will receive the designation. Contingent on the passage of the FY 2026 budget, we are also making software changes to CJAMS on our MDThink platform to streamline data collection and automate reporting to improve federal reimbursement claiming. On the request regarding the child welfare workload assessment and report, we are in the process of developing a procurement for the child welfare workload assessment and hope to have it out later this year. We are happy to provide the requested report, but ask for a due date of December 1 of 2025 to complete data processing. The next DLS item was a report on hospital stays data through September of 2025. We concur with the report request, but request a due date of December 1 in order to process the data. The next response regarding committee narrative requesting DHS provide child fatality data by jurisdiction. We already provide this information to the State Child Fatality Review Team, and they make their work public. We will work with the review team to update their information. We can provide the same information to DLS, but it would be duplicative. Should this report be required, we request it be due January 7th, 2026, instead of the original proposed date of January 10th, 2025. In addition, we request that the jurisdictional data not be broken down by age category, as it brings in concerns about confidentiality of personal information in small data sets. For our response to the DLS recommended actions, I turn it over to my colleague, Jessica.
Good afternoon. In response to recommendation number 6, again, to repeat with Dr. Studstill, updates on child fatalities. We already provide this information to Child Fatality Review, and their work is made public. If we are to duplicate these reports, we ask that the report be due on January 7, 2026, and not the original proposed date of January 10, 2025. And we also ask that the request not contain the jurisdictional data broken down by age. Recommendation number 8, DLS proposed 5% reduction in fiscal year 2026 regarding provider rates. We do not concur for the earlier reasons stated on rate reform. Reason number 9, the monthly data on out-of-home youth placement. Again, we do not concur, as we are taking an alternative approach via a public-facing dashboard with live data. Recommendation number 13, the BRFA language that FY 2026 provider rates may not increase past rates in effect on January 1, 2025. We do not concur for the reasons stated in our rate reform discussion. That concludes our testimony, and we thank you.
May I just, for the record, say that we concur with the DLS recommendation, all the other DSL recommendations, except for the ones that were just highlighted. And with that, Chair, we're happy to take any questions that the committee may have.
Senator Hadelman.
Two questions that deal with totally different things, if I could ask. So it certainly looks like the trend with regard to hospital overstays and hotels is going in the right direction. Some time ago, you contracted with the Mosaic Group to conduct a national review of best practices on the continuum of placement, and I'm just wondering, has that report been issued and completed?
So we contracted with the Mosaic Group on one of the, to provide information for one of the class action suits that we have, and they're still working with us around that information. And their efforts were to help us to look at best practices around children who have psychotropic medications. We are in the process. We have just gotten the guidelines and are under review, and that will be published probably this spring.
This spring. Okay, thank you for that. And second, I'm trying to wrap my brain around the recommendation that you don't concur with regard to rates. Can you just, changes? We went through a change in how rates were considered this past year. Is that correct?
Correct.
And then, so you said you don't concur, but can you put a little more flesh on the bones there about kind of the changes that folks are going through now and why you, I mean, obviously you object to it because you think providers should be paid more money to care for people who are often in difficult situations, but can you elaborate a little more, please?
Sure. So rate reform in the state of Maryland had been stuck for a number of years until last year when we were able to get it over the finish line with the help of our budget committees and the governor. And so for that, we're grateful. We are continuing, as I said in my testimony, to build out our continuum of care. And we believe that rate reform is one way for us to be able to address the needs of our providers so the providers can have the resources to build the innovative program for children who have complex needs. So we have worked on addressing the systemic issues within our system. We believe any reduction in that, in the rate reform, in the rates that we provide to our providers will then have an adverse effect of us being able to be innovative with our providers for them to develop programming to meet the unique needs of kids who are in our system.
So just one follow-up question to that. So how do they compare to our neighboring states' rates? And well, if you could answer that, please.
So I don't have the information around the comparing to our neighboring states. I can provide that for you. What I do know is that when we did our last rate reform setting, when we did this, we worked to look at actual costs that our providers had, and we built out the actual rates based on actual costs for children, for the services that are provided. And so those are based on the costs that were actually happening in 2025 versus costs from 10 years ago. And so we can look for the information around comparable states, and we can also share with you some of the additional information of how we got to the current rates that we have now.
Thank you. And just one more detail on that. So the current rates, though, are the rates that were increased for FY25. And the suggestion is to keep them at 25 and not to increase them further. Is that correct?
And there's an additional recommendation to reduce it by 5%.
5% across the board. Okay. Yep. Thank you.
Senator Zucker.
Thank you very much. Good to see you all. I had a quick question. Mr. Yee did a great job showing that portal. How often is it going to be updated?
So that will be updated at least weekly.
Okay.
So we'll have it updated on weekly, so it'll be kind of live. Hopefully we'll get to the point where we can update it daily, but right now we're planning to update it weekly.
And then I guess back in 2012, then Delegate C.T. Wilson, now Chair C.T. Wilson, and I passed legislation providing opportunities for foster youth to have internships in state agencies across the board. If you can, sometime in the next few days, well, after the weekend, obviously, but if you can provide me an update with that, or the subcommittee an update on that and how the program's going.
Happy to do so.
And then third is, I just had a quick question. So I think it was item number 6 around instances of abuse and death. You all said that you're reporting that already to another agency, and that reporting it to us would be duplicative. Is that correct?
So
it's already...
there is the Child State Fatality Review Team, and that information is reported and on their website. And I think the request was for that information to be updated, which we're happy to update, work with them to update that. We're happy to develop another report, but we hope that it will be synced so that there isn't discrepancies between the timing of the reports as well. And so we can our idea is that we can submit one report so that you have the same information across the board.
And when is so the timing, so you had asked for a certain date to provide that to the Department to the General Assembly, really. Is that coincide, like, I'm just trying to figure out, you already have the report that you've already submitted?
They have not, and I think that was the analyst, the child fatality review team has not updated the data, but we're happy to submit the data that we have. We're also working on updating our NCANS data, so we will also report this information to the federal government, and we can also submit it as aligned with that same timing of the federal government. Part of what we're trying to make sure is we have consistency of information so that there is less confusion in what the data is telling in the public.
So, Mr. Chairman, I'm a little confused, but all good, right? So I'm just want to make sure that if we're able to get, if it's duplicative, which I don't really know, if they already have it, they should send it to us too. So I'm just trying to make sure that we obviously don't want to put the agency in a bind, but if they already have the data, they should share it with us. If they don't have the data, like, we want to work with you on it, obviously. But I mean, you're talking about children, I mean, this is like not, how many meals they've had. This is about abuse, deaths. I mean, this is
Serious.
yeah. Thank you.
Madam Deputy Secretary, my line of questioning is very similar to my colleagues to the right. When was the last time the Child Fatality Review Team updated their website?
So if I remember, 2019.
2019. So who staffs the Child Fatality Review Team?
It is not under we aren't the department under us. I believe it's the Department of Health.
Department of Health. I hold the same posture that my colleague is saying, that this holds a certain level. I guess I want to make a comment before I make that comment. Sure. The posture that the agency took last year was very different than the posture that the agency is taking this year. When we asked for reports, the Secretary was overwhelmingly, I would love to give you more information. I want to make sure that it's a partnership from a transparency standpoint. And it was several times throughout the written testimony where I read, the department believes that this is duplicative, we're about to put it up on the website, or things of that nature. Hey, it's another group that's doing this information, so we didn't. So I just want to lean in and say that it's a very different posture than what was taken last year around information sharing, partnering with DLS, and making sure that we're moving in sync and in the same direction with the respective agency. I lean in and say that my colleague to the right, Senator Zucker, was in the right space when, like, that information, if you're sharing it with them, just share it with us too. Like, just because it's duplicative, it doesn't mean that it doesn't have that certain level of importance that it shouldn't be shared from that standpoint. So I get that it's a little bit of extra work, but at the end of the day, from an oversight standpoint, the General Assembly, you guys are the executive branch. You're running day to day. Ours is just to make sure that that day to day and that train is actually staying on the track. So we do need information in order to do that job to its fullest extent. From that standpoint, we'll have conversations about that offline as a committee. But I just wanted to lean in and say I strongly feel as though the posture last year and the posture this year is very different from an information sharing standpoint.
Thank you, Chair. I don't believe that's our intent. Mm-hmm. Our intent really is to make sure that what we found this year in our reports, and as you heard, and I think it was our overview hearing, the lateness of our reports. And part of that was us really trying to streamline and understand and make sure that we had valid data. And so we are trying to be transparent. We're trying to make as many reports public as possible. We're happy to share all of those reports with you all because we are about transparency. We want to have that data. We want to have it out in the public so people can see it, not just the Assembly, but the general public, because we believe that children should be safe and we should be transparent about the work that we're doing. So that isn't the posture that we're taking. I apologize if that's the way it came across.
Yeah. I would just say something is broken if something isn't updated since 2019. And I think that as it starts to work, that may be okay with the duplicative space. But if we haven't gotten something in 5 years, I think that we're owed and due that information. I'll leave it at that, colleagues. And seeing no further questions, Madam Deputy Secretary, we do have public witnesses from that standpoint. So if you could just hold tight and we'll start to bring up the public witnesses. We do have Mr. Robert Baszler, and if we can bring him up in threes. Robert Baszler, Teresa Hessler, and Kevin Keegan all want to provide oral testimony. I believe that I usually say it in the beginning like it goes, but I'll say it again. It's 2 minutes for oral testimony.
All right, thank you very much. Thank you, Mr. Chairman, members of the committee. My name is Rob Bassler. I am with Arrow Child and Family Ministries. We serve about 500 youth throughout Maryland a year, including youth in QRTP for young adult women and treatment foster care. So I want to kind of address the question of why rate reform needs to continue. We were recipients of the increased rates for residential providers in October. In a program that was designed to serve 23 youth, we had staffing to serve 16. In the time since rate reform, we've been able to increase our salaries. We are almost fully staffed at this point. We've been able to add clinical staff. We've been able to add additional training. We've been able to invest in improving our facilities. And we are currently serving 21 young women. Now, that rate reform has not happened for treatment foster care independent living providers yet. I have a contract for treatment foster care to serve for 71 treatment foster care beds. I currently have 40 foster homes, serving about 40 kids, up to 45 at times. There's a huge gap in what we can serve and what we have the capacity to serve. The other barrier in serving is often we need to keep our census down because we are limited to a max of 10 cases on a social worker's caseload. In the last 3 years, the average time it has taken us to replace a social work staff that has left has been 9 months. Our salaries do not match kind of the going rate for social worker salaries in the state of Maryland. Rate reform, improving the rates for TFC and independent living providers will allow us to staff competitively, pay competitively, give foster parents a higher rate of reimbursement. And so we really urge you to make sure that rate reform continues. Thank you.
Good afternoon, Mr. Chair and members of the committee. My name is Teresa Hessler, and I'm here representing the Maryland Association of Resources for Family and Youth, also known as MARFI. Our members represent over 200 programs that serve Maryland's most vulnerable children in foster care, adoptive services, group homes, and independent living programs. The need for continued provider rate reform is urgent. And as Rob mentioned, without proper funding, providers struggle to retain social workers, behavioral health professionals, and foster parents, leading to instability in placements and gaps in care. Additionally, the funding increases for treatment foster care and independent living programs is essential. Youth with complex behavioral health and mental needs require intensive structured support. However, current reimbursement rates do not reflect the true cost of providing these services. Without increased funding, agencies are forced to limit placements or shut down programs, reducing essential options for children in crisis. We ask that no cuts be made to what has been proposed in this budget, as underfunding has led to devastating consequences, such as children being placed in hospitals, motels, or unlicensed facilities that do not meet their basic care needs. We recognize the financial challenges facing the state, but investing in our children is investing in Maryland's future. Without these increases, our child welfare system will continue to struggle and vulnerable youth will pay the price. We urge this committee to fully support the DHS budget as introduced and ensure that Maryland's at most risk children receive the care and support they need. Thank you.
Good afternoon, Mr. Chairman, members of the committee. My name is Kevin Keegan. I am with Catholic Charities Baltimore, and I'm going to stay very focused on the issue of provider rate reform as well. About 16 years ago, Maryland was a high user of residential care, group homes for kids. Well over 20% of the kids in the system were in group homes. There were immense efforts made 15, 16 years ago to reduce the use of group homes, successfully so, and reduce that pretty well to where it is today. In order to do so, there were a couple of ideas that had to be pushed forward to support it. One was the development of community-based services, right? To support the kids that aren't going to be in group homes, we need to have adequate services, and we're still struggling with that. So we're, I think, continuing to work on that in partnership with behavioral health. But the second thing is to be able to provide providers, to pay providers adequately for the kids who are remaining. Because if you think about it, the kids who were placed, it was a bit of a lazy effort at times to place more kids in group homes. It was a little bit easier, especially for teenagers who might have been a little more difficult in families, right? So now you begin to peel away the kids who maybe didn't necessarily need a kind of medical necessity criteria, so to speak, to be there. And you have kids who are the most difficult, the most traumatized, the most significant behavioral health issues left in group homes. Incredibly challenging kids. And the idea of rate reform started at that time 16 years ago. And here we are just this past October when, for at least the group home side, the RCC side, rate reform happened. And it was a huge relief, long, long time coming. And that is still coming for foster care providers. So I would plead with the committee, I would urge the committee to do what we can to resist any moving backwards on that. You know, we still underpay our staff. Some of the most challenging jobs we have are our direct care jobs, and we do everything we can to pay as much. We're not looking to make money here. We're actually looking to pay adequate wages to be able to train people as best as we can. And again, we urge the committee to resist any cuts to the rates. Thank you.
And thank you all. Colleagues, we have one last public testimony, and that is from Shannon Hall.
Thank you, and good afternoon. I'm Shannon Hall. I'm Executive Director of the Community Behavioral Health Association of Maryland. You know us, our members provide mental health and addiction treatment services across the state. In the child welfare continuum, our members deliver the entire continuum of care, from treatment foster care programs to the residential group homes that Mr. Keegan was just referencing and residential treatment centers. I'm here today on behalf of all of our members to urge you to fully fund rate reform and reject the DLS proposed cut. You heard from our members about the impact on them. I want to weigh in on a little bit more on the where the rate reform came from and where it's going. The rates were developed through a transparent process facilitated by nationally recognized firm PCG, which works specifically in behavioral health rate setting. We worked with them. They reviewed provider costs. They developed cost models to project the level of clinical care that Maryland's foster children need. And this is the process that we're midstream in, and that treatment foster care is waiting to have rates addressed next year. I think from where we sit, the key component of this is really the clinical care and the board rates for the foster parents. On the clinical care aspects, the Maryland Healthcare Commission released a report in October looking at Maryland's behavioral health workforce. Key component of that for this setting are the social workers. Maryland is not paying competitive wages. The cost of living here is higher than many of the states around us, and this creates a very difficult climate to find and recruit social workers. According to the Maryland Healthcare Commission, our state currently has half the behavioral health workforce we need to meet current needs. And as you guys know, children's needs increased during the pandemic, and our members are now competing with telehealth platforms for social workers, because a social worker can sit at home in their pajamas and do therapy all day long. So you're paying a premium to get them to come in and work with difficult kids. That's what the rate reform is funding, and we ask for your continued support for that. Thank you.
Thank you. And colleagues, seeing no questions, I just want to wrap up with comments overall. Just wanted to thank each and every umbrella organization or organization that's directly and indirectly working with folks across the state of Maryland, and say thank you. Madam Deputy Secretary, and to your team, we look forward to collaborating and being in partnership as we work together for all Marylanders. So thank you for your leadership, and look forward to continuing that strong relationship. And Ms. Bougel, I just wanted to thank you again for your very detailed analysis and helping us understand where we need to get to and how we're going to get to. So thank you again. Colleagues, this ends our hearings for Friday, and look forward to seeing you all again